Hi, I'm Dr. Richard Lipman, an endocrinologist, internist, and weight loss specialist in Miami, Florida. Losing weight and keeping the weight off can be made much simpler when using an individualized weight loss plan. My Miami Diet Plan is designed to help you find the 3 most important causes of your weight gain and then make some simple changes. Many individuals, however, need help with their hunger and cravings in the form of weight loss medications. In this video, I will review the benefits and side effects of some of the older and newest weight loss medications. The secret is to find the best medications for your individual needs. Some people I see have no control of what they eat and are making the worst choices in their meals, drinks, and snacks. Others are having all sorts of salt and carbohydrate cravings, while others simply have a low metabolism for many reasons. Either way, there is a diet medications for you. Lose 3 to 5 pounds per week with FDA-approved diet medications. These medications, when matched with the right individual, have few side effects and help you control your hunger and cravings. We can help you find an individual plan, whether you have 10 or 100 pounds to lose. As an endocrinologist, my office treats diabetics, people with high blood pressure or thyroid dysfunction routinely. If you have any of these problems, we can help you lose weight, which is often what is needed to control the medical problems. Here are some of the medical complications of excessive weight gain, including arthritis, cardiovascular problems, diabetes, high cholesterol, and blood clots. People with severe obesity have a lower life expectancy and often notice job discrimination. Here are some of the older and newest weight loss medications. Older pills that you may be acquainted with include Adipex, which is Phentermine, Fastin, and Ionamine. Newer medications include Belvic and Qsymia. Finding the best medications for you involves understanding these medications, including how they work, their possible side effects, and then matching them up with your eating habits. Qsymia and Belvic increase chemicals in the brain controlling hunger, cravings, and fullness. Remember, Qsymia contains 2 actual drugs within the same capsule. Both Phentermine and Topamax affect the hypothalamic appetite centers in the brain, increasing chemical messengers including dopamine, norepinephrine, and serotonin. This produces fullness, decreases appetite, and decreases cravings. Belvic affects slightly different appetite centers in the brain and increases only serotonin directly in the appetite center of the hypothalamus. This produces fullness and decreases hunger and cravings. This is how Qsymia was designed very smartly to control hunger, cravings, and fullness throughout the day. Hunger peaks, as I showed you before, several times during the day. And following the hunger, there's periods where you experience fullness. Cravings occur late in the afternoon, the blue line, and occur into the early evening. The makers of Qsymia designed the Phentermine to be released immediately and gradually decrease through the day so that there was very little left late in the evening, so you would not be bothered by the insomnia that occurs often with Phentermine in much larger doses. This is not seen in Qsymia because the dose is so low and taken so early of Phentermine. The Topamax part of the Qsymia is a delayed release, so that most of the Topamax is not actually available in the blood and the brain till 3 or 4 in the afternoon, and then it gradually decreases at bedtime. The Topamax sleepiness cancels some of the Phentermine insomnia, so in most people there are very few side effects and very few complaints of insomnia. In fact, more complaints come from the Topamax part than the Phentermine part, probably because the doses are so low. This combination of immediate release and delayed release, Topamax helps suppress appetite and increase fullness throughout the day. The side effects of Belvic are very, very little and quite minimal. This includes headaches in only 6% of patients, dizziness, fatigue, nausea, dry mouth, and some constipation. What you do not see are the side effects seen in typical appetite suppressors. No palpitations, anxiety, insomnia. Very atypical side effects and very minimal. Thank you for your attention. If you have further questions or desire a personal consultation, call my office at 305-670-3259. Visit my internet site at www.richardlipmanmd.com. You can download the Miami Diet Plan at my website. The complete ebook is available at amazon.com.